You see, when I started the company, we were working with a telephone. We were working with telex. You don't know what telex is, but if you look, you can check. So we are working with telexes, and the big innovation was the invention of the pager. It changed our life. So we have absolutely welcomed innovation.
Hi everyone, and welcome to another episode of Moving the Needle, where we interview the movers and shakers of the healthcare industry. Today we have a very special guest, Dr. Pascal Rey-Herme, who is the co-founder and Group Medical Director of International SOS. Thanks for joining us.
Thank you for inviting me.
So Dr. Pascal and his co-founder started what became International SOS about almost 40 years ago now.
Almost 40, yeah.
Can you introduce to us what does International SOS do?
Okay, to say 40 years ago, when with my partner Arnaud Vessier, we realized that there was room to help corporation, that's mean employer, to provide security and health services to their employee, especially when they are outside their usual environment. That employer may have a need of support to provide security and healthcare services to their employee, especially when they face themselves into outside their usual environment. So we started with the vision of providing international healthcare services to the whole workforce, not only the expatriate. At that time, there was already some services, but they were focusing exclusively on expatriate. So today, 40 years later, International SOS, we serve corporation, multinational corporation, government, and NGOs. Our aim is to protect and save life. It's not only to respond to medical emergencies, but it's also to be there to advise, help with the prevention, and of course, when there is a need, we act. Today, we have we employ 12,000 people all around the world. They are specialists in security, healthcare, logistics, which is quite important. And what we call our boots on the ground is made of 27 assistance centers across the world. We have operation in 90 countries. We have what we call location, it could be a clinic, it could be staff, in 1,200 locations around the world. And we also have a network of 85,000 providers.
And do you have any way to determine which markets that International SOS will go into?
Okay, we have client and we have user. So the client, as I say, the corporation, the government, are the NGOs. The user are their employee, dependent, and quite often the surrounding population. So, of course, corporations initially were coming to us when they were going far away from their base into an unknown environment for them. However, what we have realized, and what they have realized after time, is that actually you also need to do a lot of prevention, and employee needs support even in their home base. The needs are different. So at the end of the day, our market is employer who want to do something for their employees.
And how does International SOS supplement the private and healthcare space, the industry in each country?
So we have a rule in the company. We try to avoid duplication. So we try not to compete with something which exists. So it's vary very much from one place of the world to another place of the world. So this is where it's important to have your boots on the ground, to know what is available, to know how you are able to utilize them, make agreement with them. But then there may be some place where you do not have what is needed for the employee, mainly remote location. In this case, what we will do is that we will set up local facility so it can go from purely having a small team of healthcare professionals. Sometimes we just take local healthcare professionals and we just give them training. Sometimes we will build up a facility, and in very remote location, we are building and managing full-fledged hospital. But we will not build a hospital in Singapore, but in the middle of Papua, where you have 100,000 people around a mine, then we will create, and we are creating, building and managing hospital.
What are some of the challenges and benefits of doing healthcare companies such as yours in this economic climate?
Well, so during the past year, of course, healthcare, because of the COVID, was quite important. So what we did during this period of time is that we help the employees, but we help the company to continue running their business, to operate in a complete different environment. So we had to be quite flexible. So there was no more travel. So all the people who are usually in our company involved in supporting business traveler, we reorganize all of this to be able to provide on-the-ground support for company to be able to go through the COVID area. So it's testing, vaccination, setting up a facility, helping the company to reorganize themselves, that they were able to continue to operate. So and so of course the corporation, they see the need, so they are ready to spend money and to finance such services.
And how do you envision moving forward? What are the opportunities for growth?
Well, health and security will always be there. Prevention is extremely important. There is something which is relatively new. We conducted a survey, and what we have seen is that we did what we call an outlook study. 72% of the respondents believe that extreme weather will have an impact on their own business. So it's a huge increase compared to a few years ago. So what employer are seeing at the moment is that they have to adapt and they have to plan for adverse weather crisis. And therefore, we need to partner with them to help them with this. What we have also recognized during COVID is an increase of mental health issue, and the mental health were maybe there before, but they were not recognized. And I would say, in a corporation, you don't talk about it. You don't talk about it. Now, because of what happened with COVID, because of course, of the change of generation, employers have realized that actually not proactively approaching mental health issue, not making the employee comfortable to discuss health issue, is actually very detrimental to the work. And so we are trying to do a lot of prevention that employee can have access to mental health support as early as possible to help them functioning properly.
And in terms of overall growth, how do you manage it and optimize it against current operations and manage both the current state as well as future growth?
We're a service company, and we depend of our talent. The security, healthcare professional, logistic professional, we need those talent to serve our client. We are not the only one looking for those talent. And so we need to make the company attractive to them. We need also to retain them, and we need to make sure that they have the feeling that what they do serve a purpose, and they are not asked to do manual tasks. So for this, AI is fantastic, because thanks to this, we are able to reduce considerably the number of manual tasks. The other great thing that we are getting with AI is that it helps us getting a lot of information.
And I was going to mention AI before you did, but Do you think there's any challenges with the changes in innovation that might affect your organization?
You see, when I started the company, we were working with a telephone. We were working with telex. You don't know what telex is, but if you look, you can check. So we are working with telexes, and the big innovation was the invention of the pager. It changed our life. So we have absolutely welcomed innovation, because all those technical innovation has helped us making the job, being much more efficient, making our job easier, and helping us delivering a much better service. What we can do today with telemedicine is fantastic. We can do training. We have people, healthcare providers, who are working in remote location. We can train them remotely when they don't have a lot of work, where before we'll have to organize a training camp, getting them back to a base. So we are seeing those innovations as fantastic opportunity for us. So I would say our main challenge is to make sure that we don't miss out of those innovations, that we do a proper assessment of what is useful to us.
And with such a big international footprint, how do you manage the regulatory laws in each market?
It's a nightmare. So thanks to this, we have a very large compliance and legal department. Security and healthcare is most likely one of the most regulated industry. Each country has its own regulation. The regulation differ very, very much from one place to another. So we are, and then in addition to this, you have all the privacy issue, where again, regulation vary very much from one, depending on where you are in the world. So we always want to be compliant where we operate. So we always respect the rules and the law of the country where we operate. Therefore, we need to have specialists, legal specialists, who are aware of those laws and see whether the way we operate is compliant. It's very complicated.
Yeah. And I guess with different, especially in the healthcare sector, there's a lot of different guidelines that differ from each country to the other. Does that ever affect your decision-making process of how you serve each client in each market?
Yes, there are some medical protocol, there are some change and variation, but honestly, that's not a huge issue. Yes, with COVID, the rules were changing from one country to another, but at the end of the day, especially after a little bit of time, there is quite a lot of commonly accepted procedure. Where you do have a problem is with the healthcare provider. You need to be registered in one country. If you are registered in Singapore, you cannot deliver service in Malaysia. You don't have to go to America. It's as complicated. Each country wants people to have their own, to be registered in their own country. And for telemedicine, telehealth, the rules about what you have the right to do, what you don't have the right to do, again, vary from one country to another.
Thank you so much for your time today.
Okay.
If you have any final words you would like to add?
Well, what I would like to add is that we started this 40 years ago. It has grown quite a lot. But what we are seeing is that the need around the world is far larger than what we can deliver. So I think I'm very comfortable about the world.
Thank you once again for joining us today, Dr. Pascal Rey-Herme, co-founder and Group Medical Director of International SOS. This is an episode of Moving the Needle. Catch us for the next episode.